Welcome back to Ozarks Fox. The cost and quality of healthcare in the United States is an ongoing conversation in our country, whether that's at the dinner table or the stage during presidential debates or in Congress. Universal healthcare seems to always be brought up as an option. Of course, the Affordable Care Act has support from some and not so much from others. And then there is Medicare and Medicaid coverage, and those are complex topics. And one professor at MSU and his students are trying to gather as much information as possible, examples from other countries to understand healthcare better and possibly come up with some ideas for a solution here in the U.S. Dr. Michael Merrigan is here with us, and Abby Pinniger, a student at MSU. Thank you all so much for being here.
Thank you.
So I understand you guys were in London and Paris in May of this year trying to learn how their healthcare works there, hoping to compare, contrast, and get some ideas for us here. Tell me about that experience. What did you learn? What was that trip like?
Well, one of the reasons I chose Paris and London is by all the statistical analysis, they have the highest quality, low-cost healthcare systems of the industrialized nations. So that's why we started there. We went to London first, 5 days there, 5 days in Paris. We had academic visits with physicians, physician networks, hospitals. We actually interviewed a vice president of a private healthcare insurance company there that's trying to get a foothold.
When we talk about saying highest quality healthcare, what does that look like for a patient? What exactly does that mean? So
they have a lower mortality rate. Secondly, they actually have a longer life expectancy. And then on all of the kind of metrics, vaccinations, all the primary care things, they have a much higher percent of patients who actually comply with those than we do here in the U.S., which leads to less of the real sick care and more of the preventative care.
Now, Abby, as a student, was it your first time going to London and Paris? I guess specifically as a student and going into healthcare facilities.
Yes, it was the first time I'd been to Europe ever. The people there are very proud of their healthcare organization. They have a very high sense of pride about what their country is able to provide. But then you get the other spectrum where you have the physician that is no longer serving that we talked to, who was dissatisfied because they don't get paid as much, and they have just a lot of issues within the healthcare system there. So there's a lot of positives there, but there's also a lot of negatives.
It is a lot cheaper to go to school there to become a doctor in these countries, but then they don't get paid as much. Can you talk to me a little bit more about that?
So students go right into med school out of high school. So like Oxford University is composed of like 39 different colleges. So one of the colleges is the College of Medicine. So they go straight into there, 4 years of that, and then they have a 3-year residency. And if they're going to specialize, it's a couple more. So in essence, they cut out 4 years.
What did you think about that and looking at that difference, Abby, as a student and someone who's going through this process and comparing it to someone going through basically the same process in a different country?
Well, obviously there's a little bit of jealousy there because I'm still paying on my first education. So the fact that they're providing and able to get providers free education there is an incredible benefit. Although the downside is that they do get paid less, and that's why we see a lot of those providers coming over to the States and serving here.
And then you talked a little bit about the universal health care coverage. You mentioned, Dr. Merrigan, private insurance now trying to come into that world of universal health care. How does that work? Are people happy with universal health care, whether it's the providers or the patients? And how do people feel about private insurance trying to make their way into that part of the world?
And the trade-off is wait time. They can get in to see their primary care docs within, I think they said, 2 or 3 weeks. A specialist maybe a month, so there's not this long wait time. But if they needed like what I consider serious surgery, but it's considered elective there, so like a total knee replacement, you're waiting a year. And so what the private insurance industry has done is they've said, hey, for £1,000 a year, Well, think about that, £1,000 a year, that's $1,300, $1,400 a year for insurance coverage. The docs get you in first.
What are your biggest takeaways then? What can we learn? What did you learn there that you're bringing back to the U.S. that you hope to share with the public, with lawmakers, some ideas, some tips that you have learned there that we can possibly apply here to make healthcare better here, whether that's Affordable Care Act or everything?
Well, I think the biggest takeaway we had was the whole universal coverage. And not only it being universal, it was pretty expansive coverage. So one of the things the students were surprised about is the government covers abortions, in vitro fertilization. It's universal to everybody. You don't opt out, you're in. However, in the UK, they pay a 10% tax for public services, and that helps fund their coverage. So, and it's not a sliding scale, it's 10% of your income. And so that's why the high income people, they'll buy the regular insurance because it gets them in quicker, and it actually hardly costs anything.
But then they're still paying the 10% for universal.
And they're still paying the 10%.
Even though they're not using that.
Right.
Wow.
Right.
Okay.
So lower income people obviously are not going to be able to purchase that additional insurance, so they're going to have to probably wait a little bit longer for the services they receive there.
Yeah. Dr. Merrigan, thank you so much for being here. Abby, thanks for joining us.
Thank you.
And we'll be right back with more right here on Ozarks Fox.